We are back with Dr. Carolyn Harraway-Smith from Cone Health. And so we are in our last segment of your text question. So if you have one, you need to get it in. This person's asking, what sort of underlying conditions do people have when they get really sick and are hospitalized?
The reminder is you don't have to have an underlying condition to get sick. Although the vast majority of people who get really ill do, we've had perfectly healthy people get very sick from COVID and actually die. So the myth is that you have to have an underlying condition. Having said that, people who have multiple other factors, heart disease, they're elderly, obesity, diabetes, conditions like that put someone at greatest risk. So the more healthy you are, the less likely you'll have a severe infection. However, again, we've seen perfectly healthy people get the infection, get very ill, and die. So it's not worth the risk.
Mm-hmm. This person is saying, is it true that Omicron is less severe?
We have seen fewer adverse outcomes and fewer deaths with the Omicron than the Delta variant. I think the thing to remember, though, is because it spreads so much faster, the hospitals have been even more overwhelmed with people because it's just the sheer number of people who get sick and get symptoms is higher. So it's kind of a catch-22 on which is worse.
Okay. This person says, I was exposed to COVID Sunday a week ago. Am I out of the woods for getting infected?
I wouldn't say out of the woods completely, but you have a lower chance of actually getting sick.
Mm-hmm. This question is, do any of the vaccines work better than others? I've heard other doctors say not to get the J&J.
They're all superior to not being vaccinated. And I don't want to promote one over the other. There have been some issues with the J&J vaccine that leave people concerned, and they don't have a booster yet with J&J. So if you can get a vaccine and a 2-dose vaccine and get the booster, that would of course be my preference. But all of them are better than not being vaccinated at all.
Mm-hmm. This question is, are all patients at Cone sick with COVID, or did they go in for another reason and then test positive? I think they're wondering, how do we do the numbers?
That's a really good question, actually. We do have a certain number of people. I think the number is between 8 to 10% of people who come in, and because we're testing everyone, they test positive, but they don't have symptoms from COVID. It's from something else. But the vast majority of people that are admitted into our facility with COVID came in with COVID-like symptoms.
Mm-hmm. This person says, how would you know if you're allergic to the vaccine?
Like any allergy, if you get the vaccine and have a reaction, we would know. Everyone who gets the vaccine has to wait and be observed for a set amount of time to make sure that there's no reaction. And the number of reactions to the vaccine has been very low. So unlike some people say, well, I'm allergic to everything, so I can't take the vaccine. And even in those patients, we've been able to observe them and see that the number of actual reactions has, when I say reactions, allergic reactions, has been relatively low.
Mm-hmm. This person's asking, what should I do if my at-home test, a rapid test, is different than the PCR lab test? And
so the PCR lab test is a superior test to the at-home test. So you would go with the PCR test. And so that may have some issues. So for example, if someone goes in and they're tested with the PCR test and it's negative, and then 3 days later their at-home test is positive, well, they could have converted and now they're COVID positive. So it just depends on the timing. So, but if your at-home test says it's negative, but the PCR says it's positive, then you have COVID.
Okay. This person's saying, what side effects should I expect after getting boosted? And this is just a real quick answer.
The same as the other ones. You can have, muscle aches, low-grade fevers. They're all self-limited, and most people do fine after the booster. So if you've tolerated the first 2 injections fine, you should do fine with the booster as well.
Okay, great. Thank you so much for your time and your expertise. If you missed any of this information, all you have to do is go to the To Your Wellbeing page on our website. It is all right there.